Hi, I'm Evilise Page, and thanks for listening to the Believe Big podcast, the show where we take a deep dive into your healing with health experts, integrative practitioners, biblical faith leaders, and cancer thrivers from around the globe. Welcome to today's episode on the Believe Big podcast. My name is Evilise Page, and I'm excited to be with you today. We are welcoming back my personal friend and previous guest, Dr. Steve Rallis, the wellness doctor from Ontario, Canada, who is here to talk to us about detoxing the body after a CT and PET scan with contrast. Dr. Rallis is an internationally recognized authority on IV vitamin C in the supportive treatment of cancer and a leading authority on wellness. He recently published a book about high-dose IV vitamin C. I would encourage everyone to get it, and it's titled When Oranges Become Apples. Dr. Rallis is a licensed doctor of both chiropractic and naturopathic medicine, and is part of the faculty at the Trinity Medical School of Integrative Medicine. He also received his undergraduate degree in biological sciences from Western University in London, Ontario, his chiropractic degree from Parker University in Dallas, Texas, and his naturopathic medical degree from the Canadian College of Naturopathic Medicine. Dr. Rallis has a keen interest in both research and education, and his private practice in Ontario is one of the world's first to offer integrative functional medicine rotation for medical students. He is also the chief medical officer for the DripBar in Canada and the United States. He is an international lecturer and has lectured to patient and physician groups throughout North America, South America, and Europe. He is married to his beautiful wife, Michelle, and they have 2 children. Welcome to the show, Dr. Rallis.
Thanks, Evilise. So good to be here. And speaking of the book,
yes,
the chapter about your story is really one of my favorites.
Aw.
But the reason actually, the reason I brought this book up today is in chapter 4, I talk about the radiation treatment. So using IV vitamin C for radiation.
Yes.
And I actually had a friend call me last night, and he said this out of the blue. He didn't know I was doing my podcast today with you, but he said, you know what I can't stand about podcasts sometimes? He goes, you get these great podcast hosts, they'll bring on a quote unquote expert, and we want the information. We want actual information, and they don't give any actual information. So I'm going to make sure today I deliver for your guests for sure.
Well, you always do. You always do. We always try and make sure that in these 30 minutes that we put in not only information, but practical tips and things that people can take away. And your last episode was just that. So I'm confident that those listening will hear that. But before we begin, we always start our podcast with a favorite health tip. And last time you shared about gratitude, telling our listeners that nothing happens without gratitude. Do you have another favorite as we begin this new year as a health tip for our listeners?
Yeah, health tip this year is related to today's topic. It's niacin, which is B3, and one of the cheapest really B vitamins to get, and it causes flushing. Or niacinamide is kind of like the non-flushing version. And I'll sort of jump right into the chase, if you will. Niacinamide, because it increases vascular flow, is a potent radiosensitizer. So it's very useful for using it during treatment with radiation. It makes a radiosensitizer, like high-dose vitamin C is a radiosensitizer, means it makes the tumor cells more sensitive to the radiation treatment. So it's easier to kill, and it's actually somewhat protective as well. But niacin is also great for cardiovascular disease. I'm giving a lecture actually at Parker University, their largest seminars in Vegas every year. So I'm presenting this year actually on anxiety. But interestingly, also, some of the old orthomolecular pioneers, and orthomolecular medicine just means using vitamins in high dose to have a therapeutic effect. And they use niacin a lot for depression and anxiety.
I love that.
Yeah. And niacin, just for the listeners out there, because I remember the first time I tried niacin. And niacinamide is non-flushing, also called nicotinic acid, but niacin does cause flushing. So you take it, and because it causes vasodilation, you get a flush. It looks like you're having a hot flash, I guess. And I remember the first time I took it, I was heading from Toronto back up to Barrie, and sort of halfway there, I started going, oh, feeling like super hot. And then I go, oh, it's the niacin. I get home, I take my shirt off. Michelle walks in the door and she goes, what the heck happened to you? Because this is the middle of winter and I have all these red blotchy spots. And I said, it's the niacin. Anyway, it sort of down regulates, but niacin actually is a very useful tool. So as far as one of the cheapest nutrients, like think about it. You have a nutrient that basically costs pennies that enhances the effect of radiation treatment for cancer patients. It makes the tumor cell so much more sensitive to the radiation treatment. It's useful. It's one of the cheapest, easiest tools for a lot of cases of depression. In fact, if you look up niacin deficiency and depression, a lot of old Dr. Abram Hoffer's work, you'll be blown away when you see this list. So anyway, it's a long-winded, but that's my tip.
I love that. And I know that we're not giving any kind of medical advice and people have to speak to their practitioners about what dosage is right for them. But just if you could quickly share, how often do you take niacin for, if you're doing radiation treatments, for it to be a therapeutic dose? I should just say in generality, what's the overview for that? And then those who are struggling with depression, who may be listening to this, what is a therapeutic dose that they could potentially start with or do?
Yeah, one of my teachers, Dr. Jonathan Prowski from the Canadian College of Naturopathic Medicine, he used pretty high doses. I typically, for a lot of the cancer patients that are doing radiation therapy, I'll do like niacinamide, so the non-flushing, 500 milligrams twice a day, pretty low dose. I'll sometimes have them start with 250. And again, always remember, even the non-flushing niacinamide can cause some flushing.
Okay.
The last thing you want to do is go to the ER thinking you're having an allergic reaction, because you're not. That's how the nutrient works. And a lot of patients have ended up in the ER foolishly. And by the time the doctor sees them, the flushing's gone. And then they go, oh, right. They told us it would cause flushing.
So yeah, we can do an actual podcast on niacin next time. But I just wanted to know, is there a difference between niacin and the niacinamide that you said, the flushing and the non-flushing? You can do either and it has the same benefit?
Generally, yes. And if you're looking more for vascular flow, so if you're talking about heart disease, erectile dysfunction, using niacin in that scenario, or even, I would argue, even certain radiation, because cancer, and this is true, I learned when I was in Germany, those integrative hospitals, the cancer hospitals, the one thing they really sort of mentioned in the way they or sort of assess the patient integratively, they'll say like cancer patients will oftentimes lack fundamental heat as the cancer progresses. So that heat goes down, and niacin causes the warmness, the flushing. So I think actually niacin, the cheap version, is better, even though almost all, of the reputable doctors are always recommending niacinamide. I think it's partly because everybody's afraid of the flushing, but the flushing is actually amazing because you kind of feel like warmed for a little bit,
Yes.
especially if you're lacking core or fundamental heat, and especially during this cold snap.
Yes. And, one of the other benefits of mistletoe therapy, which is it warms the body as well.
Yes.
And I also use niacin before entering my sauna as a way to flush as well. So I've heard of it being used in so many different ways, and I did experience the flushing, and it was like, whoa, that was really strong. So so make sure that patients know and individuals know that will be a cause, but it's not anything wrong. It's just helping your body flush itself. So today, we wanted to really dive into PET scans, CT scans, and MRIs. For those who are listening who are, semi-familiar with these test, as many cancer patients have to have them done. Can you briefly share the differences between a PET scan, CT scan, and MRI to start?
Sure. First of all, almost under most circumstances, your oncologist and your oncology team is going to pick the right scan for you. So I would generally be rest assured that that's almost always going to happen because they're doing it based upon where the tumor burden is or where you're checking to clear. So a lot of chest related cancers will oftentimes have a CT scan. Certain head and neck cancers will sometimes use CT, sometimes use MRI. And again, CT is the imaging from an MRI, the magnetic resonance is different than the computed tomography of the CT. The nuance probably isn't so important in terms of the patient. In general, MRI is a more advanced technology and oftentimes can have a little bit more specificity, but that's not always the case. So almost always trust the oncology team because when people start to sort of overthink it, they get lost in the weeds. PET scan is very valuable because it's just a general scan. So you take you drink a radioactive fluid. The fluid goes to sugar-based. It's just sugar basically with a radioactive ligand, goes to tumor cells because the sugar draws that up. And that tells you where there's a potential tumor burden or where there is increased glycolysis. Really, it's just drawing up the sugar to that area so that if patient, let's say you did an MRI, which is very good for prostate cancer. You saw that there was potentially tumor there, been biopsied or not. Next step would be a PET scan. PET scan tells us whether the cancer has spread either beyond the capsule or more specifically, if it's gone to other parts of the body, pelvis, liver, lungs, etc.
Yeah. As a side note, isn't it interesting that they use sugar? According to some medical practitioners, sugar doesn't have an effect on cancer. What you eat doesn't matter. Yes, it does. And I think it's so fascinating that a PET scan uses sugar because I was told that cancer cells absorb, the sugar or metabolize it 100 times that of a natural, a healthy cell. And so I think it's at least that, right? So I think it's fascinating. So it's so even equally important as a side note to cancer patients to avoid sugar at all costs. So I just found that fascinating that you shared that.
Yeah, it's a very rich comment, whenever someone says sugar doesn't matter. Oh,
yeah.
But that's the driving, fuel for that tumor.
Exactly.
So much so that it's so predictable that we can use a radioactive sugar, it goes straight to the tumor and we can image it.
Yes.
Like instantly. When you think of how quick that is too, it's not over several days. It's a glycolytic pathway that's so radically magnified that we can instantly image it. Like that alone is, it's incredible.
Yeah. So I always tell patients that they always have to balance the pros and cons of every test and every treatment. What's best for you. It's very individualized. I have read that one CT scan is like 100 chest x-rays and that the ionizing radiation from these tests can actually cause cancer in the future because it damages our DNA. So you really have to be mindful of how often and, the potential for the future depending on how old you are. So what factors influence the decisions to use a CT scan versus a PET scan for a cancer patient? And how often do you recommend patients to have these imaging done? Because conventionally they say every 3 months.
Yeah, it's too much of an open-ended question to really answer realistically because it's totally dependent on the patient's cancer. I would say that everything you said is true, but there are only several ways to kind of measure progress. And imaging is one, lab work is another, and circulating tumor cells, which maybe falls under the lab component. But there are a lot of lab tests that are really cheap and easy to measure progress. So I always use those. So for example, oftentimes a patient will have an image, it will come back clear. And they'll say there's this tendency to want to say the cancer is in remission. I think, which is from a chronic disease perspective is somewhat foolish. It's better to think of like the goal, and we've talked about this a lot, is that patients with cancer, becomes like a chronic disease. They live long and healthy lives. So you just learn how to manage that chronic disease. So you don't ever think rheumatoid arthritis is gone. Lupus is gone. No, it's just the inflammatory markers are down. You don't have any of those presenting factors. So essentially your chronic disease is quiet. Great. Forever until you die when you're 100, which is perfect. And I think that it gives you more vigilance. And then when you look at some of the lab markers, I think that they're really sensitive. Things like inflammatory markers, like insulin. I talk a lot about this in the book. And I've talked to you about this as well. And it's really important to keep your eye on those markers. Like, for example, with cancer, copper goes up, zinc goes down, ferritin goes up. Inflammatory markers like sedimentation rate, C-reactive protein all go up. If you're seeing those trending up, even if you're not due for your CT or MRI, best imaging that's been sort of allocated for your particular cancer, book it. Especially if you're not under the care of an integrative physician who's doing, let's say, circulating tumor cell counts. But that's when I would sort of jump the queue, if you will, and consider having imaging. For those that are in active surveillance, they're super healthy, there's really no tumor burden, they're the ones that are sometimes more concerned about the damaging effects of ionizing radiation. So in those situations, it's when we use antioxidants more aggressively. The reason I like high-dose vitamin C is not because it's an antioxidant. It's not. It's an oxidative therapy, but it's selectively cytotoxic. It's only damaging potential tumor cells. And there is a component which is actually protective. So I'll always do sort of a titrating vitamin C IV for patients that are doing imaging, even with ones that have no tumor burden. So we'll start at maybe 10 grams, go up to 25 grams. I sort of stay in that 10 to 25 gram range for those patients that have no tumor burden. I will add in glutathione for those patients before and after. So I will IV load the glutathione. Orally, they'll be taking supplements like N-acetylcysteine, vitamin A, C, E, selenium. Selenium is critical. And then you can sort of raise the antioxidant status, which is protective, drive it with a little tumor damaging effects, if there are any, with the high dose vitamin C as you've titrated up. And you get this wonderful protection before, and then after I run the same after. So then somewhat so the patients can be kind of they can rest assured that they've done what they can. And I did this for myself when I had my own MRI on my knee that I injured. I sort of went through the same process. I did vitamin C, did the ACE, selenium, and zinc. I did astragalus is actually very good. And so is ashwagandha, sometimes for protective effects as well. And the issue with a lot of botanical medicines, like the Chinese sort of medicine that's botanical, is that you have to find the right dosing and sometimes work with your integrative provider for that.
Yeah. And is there a certain time frame that you should do the high dose vitamin C before and after? Do you have to pause? I know before surgeries, they have you pause the vitamin C. Is there a time, like the ideal time to do the high dose vitamin C before and after the imaging?
Yeah. Well, not really for imaging. For surgery, oftentimes the concern is blood thinning or interaction with any type of anesthetic. But essentially, in terms of imaging, there's really no concern. You can run vitamin C. And like I said, if there's no tumor burden, I'm going to be in that 10 to 25 gram range. I'll do that even the day before imaging. I'll do 10 grams with glutathione. But I'll try to have, in general, at least 3 treatments before, at least 3 treatments after.
And if there are those individuals that, for cost prohibitive reasons, can't do 3 treatments of IVs before and after an imaging, or aren't having a consistent, whether it's mistletoe therapy or IV therapies that can be added onto it, what would be your best course as far as knowing you're going in for an imaging? What is the best cost-effective way to protect your body before and after?
Hydrate like heck. So be hydrated. Very important. Hydrate before and after.
What would be considered the best hydrating? How many cups of water? What do you consider?
In general, and if you have a good water source, anything over 2 liters, you probably need to add electrolytes if there isn't an abundance of electrolytes already inherent in the water supply. So because it's going to have an antidiuretic effect over 2 liters, so you're going to actually become dehydrated. So you definitely want to hydrate anything over even 1.5 liters, probably add electrolytes, which would just be things like magnesium, potassium salts, etc. So that's a good rule of thumb. I would say adding things like chlorophyll, or you'll see, which you have to be careful, but you can use things like chlorella spirulina as tabs, which are naturally binding. So again, they can sometimes bind toxic exposures if you're taking those. Relatively cheap. Just make sure that they're tested, they're third party tested. Because again, they can actually come with toxicity from different parts of the world. Vitamin A, like I said, vitamin E, selenium. I would use N-acetylcysteine because N-acetylcysteine is the precursor to glutathione, maybe liposomal glutathione as well. And that's a relatively, I wouldn't say cheap treatment, but those supplements are relatively cheap, save for liposomal glutathione.
Yes. And we'll put the links, if you can send us your favorites, we can put the links in the show notes. But that's actually what I did. I personally financially couldn't do, IVs before and after. So I found that there is a glutathione cream. And so I rubbed that against my liver, my kidneys, beforehand for 2 days. And also around my thyroid. And then I took liposomal glutathione. I hydrated really well. And I also took a homeopathic pellets that are called X-ray. And that was also very protective for me. I did it for 2 to 3 days prior. And then after, I went in and had a higher dose IV vitamin C done. And I feel like that kind of was a great balance for me personally, to cost wise, but also to protect my body. So have you used homeopathic remedies as well?
I used to use a lot of homeopathic remedies. Like I like the Unda remedies, the drainage remedies for detoxification, like the Unda 120 and 243, single homeopathics like X-ray you can use. And I wanted to say too, one of the things that we've done at the DripBar, or through the DripBar, or actually through my association with the American IV Association, was I started and this partly inspired by you, I have to say. I started an organization called Drip Cares. Part of my role as chief medical officer is to train those clinics into how to use IV vitamin C effectively and safely. But one of the things we've set up is a Drip Cares Foundation so that cancer patients can reach out and get high dose vitamin C at reduced rates. So they don't have to buy memberships at those clinics or anything like that. And they have up to like a clinics that I'm associated with is up to 40% reduced rate.
Wow.
So, and I think because they need it, and oftentimes wherever you are, you need that therapy, and it comes with certain financial constraints as well. So that's something that, we're working towards too, and we've implemented as well.
Well, I really appreciate that. And I would love to know the names of those clinics that do that so that we can share that with patients as well, to know which ones to go to that has those reduced costs. Anything we can do to save on those costs is effective. I was also told, and I just wanted to make a side note of this, don't you have to have a blood test done to see whether your body can handle high dose vitamin C? And is there a certain level of high dose that blood test is specific to?
Yeah, never have high dose vitamin C, meaning over 15 grams of vitamin C, without testing, having lab work done, specifically G6PD or glucose 6 phosphatidehydrogenase complex, because that G6PD is an enzyme which breaks down the vitamin C. And if you don't have it, it will cause red blood cells to burst, which can be a medical emergency. So if you walk into a clinic and they said, we would be happy to administer 25 or 50 grams of vitamin C, but we're not going to check G6PD, I'd walk away.
Yes. And is that something that you have to get a prescription through your physician, or would one of your IV facilities be able to do that test there remotely?
Yeah, all the IV facilities, because they're under medical direction, even though they're all under medical direction, so they've all been instructed exactly what lab tests to run for kidney function, to which, hematology tests, including G6PD, needs to be done. And those can all be done. Draws can be done on site at any of those clinics. And it's also can be just they can be given a requisition to go get that done as well.
Okay, great. And so, but if you don't have that and you really have a scan coming up, if your practitioner has not had this blood test done for you, you said you can typically get up to 15 grams of vitamin C, and that's no
Safely.
issue. Safely.
Yeah, safely.
Perfect. And so how does one know if their body has fully detoxed from the imaging? Like, and what organs are most affected by imaging?
Any organ can be affected because the issue with radiating ionizing radiation is that it doesn't discriminate tissues. So it damages all tissues. And that's the issue. And oftentimes issues that lack fundamental blood supply, poor lymphatic flow, poor vascular flow, those are the tissues that are going to be most affected. I like the idea of using physical therapies to assist when you're doing endogenous therapies. Like if you're doing hydration and let's say chlorella, spirulina, vitamin A, C, N-acetylcysteine. If you're going through that process, even berberine can assist with that. But having a massage, like a lymphatic massage, having hot, cold contrast therapies, it could be as simple as in your shower, to again, increase vascular flow, vasoconstricting, vasodilating, massage therapy. It could be simple as dry brushing. There's so many things that you can do, but gentle exercise. Also, you want to move lymphatic flow. Be mindful of your diet pre and post imaging just as well. You don't want to overburden your immune system by having massive meals. So keep it light, keep it antioxidant rich, keep it fiber rich. Mm-hmm. So even if you're on more of a keto protocol, you actually sometimes want to switch to kind of a vegetable-based keto with higher fiber. Again, find things to remove things because the colon's affected, the kidney's affected, the liver's affected. And those are simple organs that can be tested and assessed.
That's great. Yeah. And so a lot of the things that you mentioned are like pectin-rich foods, that become natural binders, like you were mentioning spirulina and things that are great for detoxing foods, which include broccoli and garlic and onions and lemon balm and parsley, avocados, all those things, like you said, are high in fiber, but also pectin-rich foods, which also helps to detox. I just wanted to do a quick recap before we close our podcast. So a few things that you mentioned is, the supplements with the niacin. Also, I've heard of resveratrol and quercetin and green tea that are also really big studied, as far as helping to protect from x-rays and from imaging and protects our cells.
And curcumin.
Curcumin. Yes. What about high dose melatonin? I've heard that taking 60 milligrams of melatonin the night before a scan can help.
Yeah, really good idea. Even as low as 10 to 20 milligrams have been shown to be beneficial both for imaging and also for actual radiotherapy. So radiation treatment, even 10 to 20 milligrams. And we know, because you're so into the game, you've sort of seen this pattern that melatonin is highly effective and it's increasing in dose. We've seen as high as 200 milligrams QPM. And I know that some compounding pharmacies are making them at super high doses. But I think that if you can easily find 10 milligrams melatonin, so you can take 2 of those or 3 of those the night before, and it offers protection. And again, also an effective therapy for those doing radiation treatment.
Perfect. Yeah. So then you also mentioned about detox-friendly foods. We talked about the OxyCell cream, which is the glutathione cream. You can put about a quarter teaspoon of it into your hands and rub it over your liver and your thyroid and your adrenals. And I've heard up to 3 times, the day of your scan. You mentioned about dry brushing and showers. I've heard about a magnetic clay bath. Have you heard about those?
I haven't. I've heard about it. I don't know much about it.
Okay.
But it makes sense to me conceptually.
Yes. Yes.
And I wanted to mention too, one of my patients that was going through, she was having radiation treatment post-resection, breast resection of a tumor. And they had recommended a cream, which she was reacting to. And you can make your own. My sister-in-law, we have an olive farm in Greece, which and she takes her olive oil and she made this unbelievable salve, like a body butter for one of our patients. And she just basically used, I think it was horsetail, calendula with the olive oil and beeswax, and applied it topically because the oncologist, the radiation oncologist wanted to have a cream, but she was reacting to the cream. So she said, is there any way you would know any sort of natural cream? And Jen, God bless her, like made this cream for our patient Robin. And it's such a beautiful formula. So it's amazing. And that's something that you can really
Is that available on the Rallis website, or is that something personally that she made?
She made it personally for the patient, but I would love to have that. I'd have to ask Jen whether she's put it on like the Rallis Family Farm or Rallis Olive Oil website. I'm not sure because they run that. I'll look because it's such a great, and I use it now. I get her to make it for me just to apply topically because it's such a simple formula and such a simple body butter that it's just good for everything.
Yeah, I would love the link if she does have it, or even just the ingredients that she uses. Your olive oil is so wonderful. That's the only olive oil we use in our home now. And Jimmy loves it. I actually started making tallow cream and added your olive oil to it. And that might be another way to really help people who are allergic to some of the creams. But Dr. Rallis, this has been such an informative podcast. I know that this is going to be so helpful for those who are undergoing radiation treatments, but are also going in for imaging and just had a lot of questions on how to protect their body. So thank you so much for taking time out of your day to help answer these questions for us and give us more insight on how we can, go into these things in a more protective state.
Thank you, Valise. Thanks for everything that you do as well. And have an amazing day.
If you enjoyed this episode and you'd like to help support our podcast, please subscribe and share it with others. Be sure to visit believebig.org to access the show notes and discover our bonus content. Thanks again, and keep believing big.